Welcome back to Healthy Living. I'm your host, Melissa Hodgson. Our show is brought to you by Tammany Health System. We're talking today about child and family services from Tammany Health System. We talked first with Dr. Perry Russell, nurse practitioner, who's with Tammany Pediatrics, the primary pediatrics group for Tammany Health System. We're talking next with Frederick. She's a pediatric speech pathologist, and she's part of the pediatric therapy group that has very recently moved in next door in the same building with Tammany Pediatrics. So welcome, Dia.
Thank you.
Glad you're here. So tell us a little bit first about your practice and what you all do.
Well, we're outpatient pediatric rehab, so therapy and wellness is what it's called now. We see kids from straight out of the hospital to 18, and it is physical therapy, occupational therapy, and speech therapy, and it is all diagnoses that you can imagine. So.
Wonderful.
That's what we do.
And so you particularly as a speech pathologist are focused on the practice, and not just of speech, but lots of other things that have to do with all of the muscles and the anatomy that give us speech.
Yes, speech pathologist is a tricky name. So we deal with speech, we deal with language, we deal with feeding and swallowing, we deal with pragmatics and social issues in children. So it's a vast array of kids that we see.
Right, and we've got from developmental issues to behavioral emotional issues, and we have some special certifications on our team for pediatric care, and that really separates that group from your average run-of-the-mill PTOT, ST shop.
Yes, Tammany has actually been very wonderful for letting us learn more and specialize a little bit more in the areas where we're really interested in and what the community needs.
And I think one of the newest feathers in the cap of the organization is we have quite a number of departments that have achieved autism certification to work with those special needs children, and I know that therapy is an enormous part of that practice.
Yes.
So you all are co-located in the building by Flower Estates with Tammany Pediatrics and the Express Care, and we'll have the Parenting Center moving in there soon. Can you talk a little bit about your move and how that went?
Sure. Well, we've moved a lot, so we're used to it, but it was absolutely effortless. It was seamless. Everybody was amazing, from the maintenance guys, the building guys that moved us, to the welcoming committee that we got when we got there from the Peds department. They even gave us a little luncheon, a luau luncheon. That was amazing. So it was nice to be able to get to know everybody and meet the nurses and the doctors and the staff in general, and let them know what we do, because a lot of people don't know what we do. So in order for them to make great referrals, they need to understand what it is that we do down the hallway.
Indeed, and now you are just down the hallway, although admittedly you were just across the parking lot, yes. So you didn't have far to go. But being in the same building, I think, is exciting, because that enables all of you in speech, occupational, and physical therapy to have those interactions with the pediatricians, with Perry, the nurse practitioner, yes. with the nurses and the staff who are part of that pediatrics group, and certainly with Express Care also in the same building.
Absolutely.
Stepping out of the building, I'm thinking too about the fact that pediatric orthopedist McCall McDaniel is just across the highway from your practice, and I would imagine that you and your coworkers do a lot of work with her practice.
Yes, PT specifically. Kristen has an amazing relationship with her, so we do get a lot of referrals from her, and she also understands the autism population, so she is being phenomenal at helping us get the resources that we need to help our kids with autism.
Good. Well, and I was thinking too about some of the processing disorders beyond autism. You got fine motor, handwriting, and some of those, and that tends to be hand and physical therapy.
That is going to be occupational therapy. So yes. So physical therapy, Kristen is our main physical therapist. We also have Josie, who's there 1 day a week. And Kristen has 14 years of experience with kiddos, and she primarily, along with, we all see developmental delay. So that's just kind of the blanket umbrella. They're not quite where they need to be. So all of the disciplines see developmental delay. But Kristen specifically is seeing a lot of infants with torticollis, also the broad spectrum of cerebral palsy. So that seems to be the majority of her kids right now. Occupational therapy is going to do the fine motor, so it can be anything from brushing their own hair to tying their little shoes, whatever it may be. Eating, a lot of the feeding skills that deal with fine motor and sensory components are going to be under occupational therapy. But she has a lot of kids with sensory processing delays right now that are we get to take advantage of our sensory room that we didn't have before.
And that's in your new space.
That's in our new space. We have a sensory gym, which we cannot be more happy about. So it's really serving to that population.
Good. And I think when we say speech pathology or speech therapy, a lot of people immediately think about lisps and stutters, and certainly that's a part of your pediatric practice. Right. But there are also, as I was saying, issues that have that are related to the muscles, the anatomy. There's some food aversion that's a speech therapy care. Can you talk a little bit about that part of your practice?
Sure. So when you hear speech therapist, which most kids call speech teachers, it's your articulation issues, your R's, your lisps, your L's, the kids who aren't saying the things that they need to be saying correctly or they're not understood. Language is the huge blanket thing that we do every day, which that's kids that just may not understand language well, they don't follow directions well, they're not comprehending very well, and then also they can't put their thoughts together to be able to tell you. So it's not that they can't say it, it's they can't organize their thoughts enough and their language enough to be able to tell you what it is that they need or want. But also we do reading and writing. We see that a lot, especially during the summer when the kids get out of school. We don't want those kids to fall behind, so we see a lot of those kids in the summertime. As you said, our fluency kids, and then feeding is an area that is relatively new in the speech world in this area. It's not new to speech therapy, but it's new in this area because occupational therapists have mostly done it. There are 3 reasons why kids don't eat: a sensory component, a motor component, or a combination of both. And we're lucky enough to have occupational therapy and speech therapy that can help them in whatever way best suits their needs. So that's one thing that's super beneficial about our clinic is you have both of us. So you may need one, you may need the other, or you could need both of us, and that's extremely beneficial to the patients.
That's wonderful. So I'm thinking that this location where you've moved is really a great advantage to those children and their parents because they've got a team of different types of therapists. They've got pediatricians and the support that they have from their nurse practitioner, the nurses and their staff. And we have the parenting center moving in there this fall. And so children from special needs and run-of-the-mill all the way across the board may be able to get the care that they need right there in that building. And then we talked about the fact that Dr. McCall-McDaniel's right across the street for pediatric orthopedics. But then right up the street is the main campus for the hospital, and you have the pediatric emergency department and the pediatrics unit. You have, for the infants, obviously, lactation consultants for mom, and I imagine that there's some synergy there between those new babies and moms and breastfeeding, along with feeding issues.
Yes.
So that's an area of future for your organization.
Yes, I am hoping and praying. So yes, absolutely. I have a wonderful relationship with the occupational therapist in the NICU at the hospital. Jan is amazing and she's taught me so much. And so once that continuum of care starts to happen where the babies are in the hospital, they're identified in the hospital having issues, mom is getting tons of education and help in the hospital, and to know that when she walks out of the door, that she is going to be led to somebody who can also help her, and she's not being sent home not knowing or just shooting in the dark. There's a lot of, I don't want to say misinformation, but it is misinformation, misunderstanding about breastfeeding and bottle feeding in infants and what's acceptable when it doesn't have to be that hard. And so it's an underutilized therapy.
Well, wonderful. I'm really excited that we're going to be doing that for moms and babies coming in the future. That is a wonderful growth area for your practice.
Yes.
And I'm excited for you all to be in this new place with the pediatricians and the parenting center coming up next. I appreciate you coming out to talk to us.
Thank you.
We've been talking with Frederick, who's a pediatric speech pathologist. And next, we'll talk with Lori Cage, who heads up the parenting center.